So I'm Jonathan Lindner. I'm a cardiologist at Oregon Health Science University. I am a professor of medicine, and I am both a researcher and a clinician up here on the Hill. A typical day for me is not the typical day of your average cardiologist. So the average cardiologist is mostly a clinician. In cardiology, there's a wide variety of things that you can do as a clinical cardiologist. Almost everybody takes care of outpatients, seeing patients in clinic, seeing patients in the hospital, taking care of patients in the intensive care unit. And then there's further subspecialization where you can be somebody who specifically takes care of rhythm disorders, electrical disorders of the heart failure, or people who do very specific procedures like interventional cardiology, where we go in and we take care of blockages in the coronary artery or implant in valves, or people who are primarily involved in different types of imaging of the heart, ultrasound imaging, magnetic resonance imaging, or MRI or CT imaging. I also have another life, which is that of a researcher. So I have spent about half of my time in my research laboratory, where we work on bench research, so doing work with in vitro models, preclinical research, which involves research with mouse models, for example, and clinical research, where we see patients with different disease states and do investigational techniques, either imaging or therapies on those patients. So as an academic cardiologist, I have a different life where I'm writing grants, writing papers, and doing studies in addition to seeing patients.